Welcome. Welcome to Healthy Trends. And this is forpay.org, sponsored by forpay.org, Consumers Dr. Bengala. Topic for this episode is about, in general, about the trend, healthy trends in healthcare. You know, lately I've been noticing competition. Yes, competition in healthcare. Yeah, let's do it. Competition in healthcare is healthy, folks, always. But the markets are not, especially your healthcare all around you, they want to drive the competition down. As a consumer, you have every right. You need to have all the tools you need for competitive world. Like any other sector, folks, you know, there has to be competition. I know that, you know, government role is compliance, and they need to make sure we comply for the consumers. Healthcare, government has done a poor job, folks. I'm telling you, government done a poor job. You know why? Because this mergers, this is not good. Healthcare, hospital mergers, medical group mergers, hospitals buying doctors' offices, and doctors buying medical groups buying doctors' offices. It is not good. It is not good. You need to have more open competition. The reason why I say that, whenever there is a competition, you know, it's good for not only good for the consumer, it's also good for the provider, folks. You know, lately I've been noticing a lot of these doctors want to form a group, and I can understand for the lifestyle, because physicians work hard. They need a break. They need to, you know, especially when you're talking about the specialties like cardiology, cardiac surgery, when they have too many, if there is I've been in a solo practice for the last 35 years, so folks, it's not easy. So a lot of physicians, youngsters want to have a group because they can share the calls. I understand that. But I'm not talking about that, folks. I'm talking about hospitals buying away the doctors' offices. This is not conducive. I really believe in that. Hospitals shouldn't, you know, doctors cannot own hospitals. I don't know if you guys know about it. Doctors are not supposed to own healthcare institutions. They cannot own pharmacies. They cannot own, even if you own a surgery center, you have to disclose it. When it comes to the hospitals, government does a poor job, folks. They don't monitor hospitals buying doctors. They don't monitor, because hospitals, this is what the hospitals industry is trying to do, is buying up doctors' offices. It's not good for the consumer, folks. I really believe you need to have open competition, and the hospitals should compete. As simple as that. And my personal feeling, as far as the hospitals are concerned, we need more hospitals, but not more short stay facilities, not long-term facilities. We don't need more long-term. We need more hospitals in the rural areas. We need more access in the rural areas. Telemedicine, telehealth has changed. It has changed the industry, folks. I believe most of these healthcare facilities should be hubs. You don't need long-term facilities, folks. Long-term facilities should be in tertiary care in a big city, but short-term facilities is the way to go. I think we need more short-term, and they need to deregulate the healthcare industry, man. Every time somebody wants to put a hub, you need to go through all the licensing, all the regulations, rules. I understand, folks. You can comply, but they cannot put too many regulations. where it costs the consumer. As I was telling you about, a hospital bed per day is $10,000 to $12,000. It is not acceptable. It should not be more than $500. Yes, it should not be more than 500, at least 1,000 maybe. But even 1,000 is high. But I would say it should not be more than 1,000. You know how we can bring it down? Deregulate. Deregulate the entire hospital industry, healthcare industry. We can bring down the cost. You know how much it costs to have a hospital bed, new hospital bed, to built in? It costs $1 million. How about that, folks? If a hospital wants to put in 100 beds, it costs $100 million. Yes. This is just bed cost, folks. I'm not talking about, the other aspects, but the bed. That's why the per day cost should be lowered by deregulating the healthcare industry, folks. I think competition is good. We'll talk about affordability. We'll talk about transparency in the next episode. I'll continue to emphasize competition. Competition among the healthcare professional is conducive and is good for the consumer. We need to encourage doctors to compete. Doctors are competitive. In general, doctors compete, folks. No matter where you put them, they're a separate breed altogether. They want to compete. But now the trend is such, hospitals are driving the competition down. It shouldn't be. We want more competition among healthcare professionals. If you look at among the healthcare professionals, they want to compete. Yes, they love competition, folks. It's a breed by itself, folks. I've been there, I've done that, and I would like you guys to, if there's a value in this clip, subscribe, share, hit the notification button, hit the like button, and this is forpay.org. Healthy trends. Follow healthy trends, good for the healthcare, for a consumer. Love you guys. God bless. See you in the next episode.